We are live, sir.
Okay.
Hi Rajat, how are
Good
you?
Good afternoon, sir. I'm absolutely fine. How are you, sir?
Very well, yeah, very well.
All right. So, sir, thank you for joining. Okay, so let me just do a brief introduction, sir. Okay. Manisha, are we live?
Yes, sir.
I am not seeing the stream. Okay. Okay, yeah. All right. Okay, so good afternoon, everyone. Welcome to this new initiative that I am thinking of doing since a long time. A lot of time, what happens is that the students have got great ranks in the exam and they have never thought about picking up radiology, or they have thought about picking up of a radiology. But now they have got a rank, they get a pressure from a lot of people that it's a great branch, they should pick up. But then they have a lot of apprehensions in their mind, that is it a clinical branch or a paraclinical branch. And a lot of students consider us as a role model, that okay, Dr. Rajat has done radiology, we also want to do radiology. Dr. Sumer has done radiology, we want to do radiology. Now there are upcoming stars are coming up, and Dr. Zainab has done radiology, we want to do radiology. But over a period of time, I feel that we are not the ideal person to guide you about the radiology perspective. The reason behind that is that for all of us, radiology is a very, very small part that we do in our life. So I thought, how can we help you more? And I have requested Dr. Harsh Mahajan, sir, and he has been kind enough to consented for this. So before I do anything, sir, thank you very much for joining me on this particular session. Those Just to introduce about Dr. Harsh Mahajan, I will say that anybody who wants to do radiology, sir is a father figure for almost every radiologist in India. He has done his MBBS from Maulana Azad Medical College, and I was not even born at that time when he did his MBBS in the 1982, followed with an MD from PGI Chandigarh, then senior residency from All India Institute of Medical Sciences. So all the three premier institute, MAMC, PGI, AIMS, sir has been a part of them. And then a fellowship from MD Anderson. I mean, I don't think I need to tell sir the degree, sir ki degree khatam ho jayenge, so I don't think I need to tell that. But sir has been the chairman of Mahajan Imaging Center, and for all those, it's a final solution for your diagnostic problem. I will say that in Delhi and North India. I mean, somebody asks you that, sir, we want to get a quality scan in Delhi. So you close your eyes and you say, send the patient to Mahajan Imaging Center. You will find a solution of it without a doubt. So, sir, first of all, welcome and thank you very much for
Thank you,
being.
Rajat. Thank you for this unique initiative. I wish we had something like this when we were planning what to do. But I hope this will be useful for those who've joined in.
Okay. So, sir, there are two ways that the students are with us. There will be some student who will be joining us in the Zoom also. And there are students who are watching us on the live YouTube stream also. So I will be sharing their questions, but there are some general questions that I'm going to ask you about the radiology, because I feel that you are the person who has seen radiology from every aspect. So, and the students are also welcome to ask their doubt. Those who are with us on the Zoom and will be joining can put their doubt on the chat, or they can let me know, and I will put you onto the screen also, where you can directly ask. I can tell you that you will not get this opportunity. I mean, sir is very, very approachable, but it will not be easy to catch hold of him because of his very, very busy schedule. So it's a very, very good opportunity that we have. So first of all, if I just broadly tell you about the radiology, I mean, say that it's a very, very good branch. We all know that there is a good, decent quality of life and everything that we're going to talk. So rather than me talking, I will request now sir to give his perspective. Sir, first of all, I want to ask you how you see radiology has changed over a period of time. You have seen that how radiology has become the most favorite branch. Then you have seen how the technology has come into the radiology, and now everybody is apprehensive about more AI coming into the system, and whether it is going to be replacing the radiology or not. You run such good centers. You have big team of the radiologists with you. When you take a radiologist on board, what are the qualities that you see in those radiologists, and how do you see a future of radiology for the buddy young doctors who have an option of picking up any branch at this point of time? Over to you, sir.
Thank you, Rajat. Those are a lot of questions, and we will try answering them one by one. At the outset, I would like to say that radiology as it exists today and in the foreseeable future has a very, very bright scope, very bright future. And I don't think the advent of artificial intelligence should in any way reduce our fervor for the subject, or reduce our desire to do radiology, because if that is what we want to do, the future is very, very bright. That I would like to say right in the beginning. If you see, and I don't speak just from the theoretical perspective, but if you see the matching that has happened in the US for their matching for radiology, each and every radiology seat has been taken up. And this happened, I think, only last week. And there is a large number of people who wanted radiology and haven't been able to get it. So, from that score, if we were to look, and India today is very much part and parcel of the global healthcare system. So, I do know that 4 or 5 years ago, there was apprehension about radiology and the impact of artificial intelligence. And there was this trend where, radiology did go down. But if we talk of this year, then each and every seat has been taken, and there have been, I think, if I remember correctly, about 46% of applicants did not have any match for radiology. Now, in our country, if we see, healthcare has undergone a sea transformation. And from 1984, when I joined my own MD radio diagnosis at PGI Chandigarh, to now, it's been a journey of, 39 years. And we've seen tremendous transformation, not only in this country, but across the globe, where with newer technologies coming in and becoming mainstream day to day, at that time, what we had was basically conventional radiology. We had ultrasound that was just beginning to come in. CT-MR had come, but they had not come in India. It's only in 84 that the first 1.5 Tesla MRI got installed at University of Pennsylvania, UPenn Hospital in Philadelphia. And also interventional radiology was coming into its own. So we were lucky at PGI Chandigarh that with our batch at that time, interventional radiology started. So my thesis topic in 1984 was on percutaneous transhepatic biliary drainage, PTBD. And I had two co-PGs. The other one was percutaneous nephrostomy, and the third was on alcohol embolization of renal cell carcinoma. So that is with our batch in this country. Actually, we were so lucky that therapeutic radiology, interventional radiology started in this country. And the slightly sad part really is that 37 years down the line, even now, people refer to it as a new branch of radiology. And that is because I think our teaching institutions have been lacking in actually adopting and taking to this field. And still there are many departments of radiodiagnosis which do not really embrace interventional radiology. And that's where we've given the clinicians a right to come into this field. But do remember, and this is for the postgraduates, that interventional radiology is very much a part of radiology. Of course, there are tough battles which have been on for a long time, and which you will also face. But if you're good in a technique, if you are willing to spend the time, if you've learnt it well, if you are willing to go to the wards, look after your patients, then interventional radiology, which is still a small part of radiology, can be the only field in which you may excel and practice going forward.
So,
So,
sir,
yes.
I just wanted to ask you, because one of a very, very big doubt that the people have is AI. And you have been a pioneer in AI also. I think for the last 10 years, you are very, very active in AI. And you
About 6 years,
have
yes.
so many centers also. Uh, I just want to ask you a very straightforward question. You have employed so many radiologists. A lot of radiologists have joined your team. What difference has come in your, I mean, when the AI was not there and now the AI is there, what difference it has come in your idea of taking up a radiologist in your team? Are you taking up less radiologists in your team? Are you taking up more radiologists in your team? Do you think that the need of the radiologist is increasing? Do you think the need of radiologists is decreasing? I want to know your view, because I have a view also on this, which I will also be sharing with the students. But I want a view from a person whose life is broadly dedicated in improving radiology in India. So, what change you have seen in the last 10 years in employability of the radiology?
I think employability of radiologists still remains very, very good. There is still a lot of scope, a lot of positions to be filled, especially for those who know their subject. The unfortunate part is that somehow we've seen with the increase of seats that has happened, where seats have doubled and tripled, with the workload overall remaining same or maybe increasing 10-20%, you have thrice the number of postgraduates. I see that, even in the best of institutions, there is training, the level of training which has gone down to some extent. But as far as the need for radiologists goes, the need is increasing, because the number of equipments that are being installed, be it CTs, be it MRIs, be it cath labs, be it ultrasounds, be it conventional X-ray systems, those are increasing. And in this country, we still have, if we talk of per capita, X-ray machines or CTs or MRIs, it is much lower than what we need. So at least for the next 5, 10, 15 years, the number of equipments that will be required, the number of hospitals that will be built is going to keep increasing.
Yeah.
We are still very, very low in numbers as compared to our population.
So maybe that means in next 10 years, we don't see a challenge that the employability of the radiology is going to be decreased. We still have a big need of the radiology that is available, radiologist.
Let me qualify that.
Yeah.
The employability of good radiologists will continue to increase, because we are getting all kinds of radiologists. We are getting radiologists from, good institutions. We are getting radiologists from institutions which are far flung. We are getting radiologists from institutions where, even in medical colleges, the CT, MR, and all these equipments are outsourced. We are getting radiologists from good private medical colleges, and we are getting radiologists from private medical colleges which may not be so good. So, and that is not only for radiology, that is for any field that one may be in. And so let me qualify the statement: radiologists who are good, radiologists who are willing to work hard, radiologists who are willing to spend time in the hospital and in the diagnostic centers, radiologists who don't take radiology because they say, and you also mentioned it, Rajit, quality of life is good. Please remember, if a radiologist is not available, then what good is he to a hospital, to a department, or to a patient. So I see this increasingly amongst the youngsters who are becoming radiologists, that they come and say, and these are all, we get the best that there are from the All India Institute or Maulana Azad or KEM or, institutions like that. We are lucky that they still want to work hard. But one thing that we hear very often, which we didn't hear 10 years ago or even 7, 8 years ago, and never heard 20 years ago or 30 years ago, they say quality of life is why we came into radiology. And that we want to be back home by 6, 6:30. हमने बच्चों के साथ टाइम लगाना है, बीवी के साथ लगाना है. That is all very good. And then they compare themselves with those who are working in the corporate sector, their own class fellows, who someone went and did a BA economics, someone went to IIT, फिर उसके बाद उन्होंने MBA कर लिया, and then they say यार वो तो साल में 60 लाख कमा रहा है, हमें तो अभी 18 लाख, 20 लाख, 24 लाख मिलेगा, 30 लाख मिलेगा. Please do remember, and this I want to tell your boys and girls, because both my boys have done MBA, and कि वो सुबह बॉस 8 बजे शुरू होते हैं, रात कब खत्म होगी उनको पता ही नहीं है. 15 से 20 दिन वो अपने घर नहीं रहते, वो किसी होटल में या किसी सराय में या कहीं और रहते हैं. The time is completely for their companies that they work in. And so when you say quality of life and you compare yourself with these people who are, high achievers, high earners in the other corporate fields, please do remember, 24 घंटे के नौकर हैं, कभी फोन आ सकता है. और 8, 9, 10 बजे से पहले घर नहीं आते, वो भी 8 बजे घर से निकलते हैं, वो 6 बजे घर एक साल में एक बार भी नहीं पहुंचते. वो सैटरडे संडे भी वो काम करते हैं. सो व्हेन वी आर कंपेयरिंग, दिस कंपैरिजन at times appears fallacious. And then you compare with the lawyers. Lawyers are a different field altogether. They are all doing very well, and I do believe they have a better quality of life. But वो भी 8, 9, 10 बजे तक जो 50 साल तक का लॉयर है वो काम करता है. और फिर ठीक है, उन्हें छुट्टियां मिलती है, उनके कोर्ट बंद हो जाते हैं, बट फिर भी जिन्होंने आगे बढ़ना है वो उन छुट्टियों में भी काम करते हैं, क्योंकि वेकेशन कोर्ट खुले रहते हैं. रजत, आई एम टेकिंग दिस टाइम टू मेक अ कंपैरिजन.
No, I agree, sir. In fact, there is no pain without pain.
What I am seeing is कि this feeling कि हमने ऐसी ब्रांच लेनी है जहां हम घर पहुंच जाए, तो आपका, and I say this to radiologists of today, क्योंकि हर कोई अगर 6 बजे घर चले जाएगा, and we are seeing this happening even in hospitals, तो अगर एक हॉस्पिटल शाम के 6 बजे से सुबह के 8 बजे तक बिना रेडियोलॉजिस्ट के चल सकता है, तो then the day is not far when our clinical colleagues will learn. And that's why I want to caution all those who, you have to be practicing clinical radiologists. You have to become part and parcel of the team. You have to be available to your clinical colleagues. You have to be irreplaceable. If you're just a report which is sent out from the radiology department, तो आपने क्वेश्चन किया artificial intelligence का, then it'll be very easy for AI to replace you, because that is a written report, you are a written report. So that human interface has to be there. Even today, the head of department, who may be 55, 60-year-old gentleman in surgery, medicine, cardiology, nephrology, neurology, वो रात को 2 बजे भी जरूरत पड़े तो वो उठ के घर से हॉस्पिटल जाते हैं, वो ऑपरेट करते हैं. Whereas हम कहते हैं हम तो 6 बजे के बाद चलो जी हो गया. So if that is your attitude, please don't take radiology, because radiology is changing.
Yeah.
You will have to be clinical radiologist. If you are a report and you say मैं टेली रेडियोलॉजी करूंगा, वो 5 साल 10 साल चलेगा खेल. उसके बाद, and coming to artificial intelligence itself and its impact. 6 years ago, or in 2016, 7 saal ho gaye, it was said when deep learning came into being, it was said, and in fact, the person who was the inventor or the developer of deep learning said that stop training radiology residents because up to AI is going to take over. 7 years down the line, nothing like that has happened. We work very, we have a AI division within Mahajan Imaging and Labs. That AI division now has got hived off into a separate startup, a separate company called Carpal.ai, Carpal, C-A-R-P-L, Caring Analytics Platform.ai. We have actually, for the first time in the world, we suggested that the platform approach would be the best way to approach it. And we have over 90 AI algorithms for chest X-ray, head CT, head MRI, and so on and so forth, which are already available. It's the largest marketplace in the world that Carpal.ai has. So we do have insights into AI and its working. Rajat, at the present point of time, it's still in its infancy. It hasn't made even 1% difference to us as yet at Mahajan Imaging and Labs in our recruitment. But as things go forward, there are over 200 radiology AI algorithms which have US FDA approval.
Yeah.
And more and more are coming. In the coming months and years, AI is going to change the way radiologists practice. It will in fact change the way all doctors practice.
Chat GPT is an example. I mean,
Chat GPT is an
That's
example. आप उसमें डालो वो आपको treatment भी बता देगा. ठीक है? And 95% of the time, even today, it will be right.
yeah.
And it can only get better. But currently, I see it functioning as if we talk about radiologists, then there is radiology technicians, there is radiology, appointment booking and all that. I won't go into that and confuse the issue. But if we talk about radiologists, in the short term, AI is certainly going to work as the radiologist assistant, improving our output, improving our throughput, hopefully improving our accuracy, improving turnaround times. अगर आज मैं 25-30 रिपोर्ट लिखता हूँ CT/MR की, तो we hope कि वो हम 50 लिख पाएंगे, 100 लिख पाएंगे. The ultimate goal is कि 500 लिख पाएं, जैसे पैथोलॉजी में हुआ है. The second thing is that for certain things, it's going to replace the radiologist. Normal chest X-ray versus abnormal chest X-ray. It is going to replace the radiologist. Normal head CT versus abnormal head CT, where the radiologist ultimately will see only the abnormals, not the normals. And in due course, it will, for a large amount of things, it will replace and be able to do the work of the radiologist. But radiologist function also, I think, will evolve. And I'm very, very passionate about the term integrated diagnostics. जहां की डेटा इतना बढ़ रहा है, radiology is digital, other fields are slowly trying to become digital. So मुझे लगता है कि radiologists will be best suited 5 years, 10 years from now to become this integrated diagnostician where radiology, nuclear medicine, genomics, pathology, lab medicine, all of these, I feel, will form a part of integrated diagnostics. And radiologists will be best suited to become
headed by the radiologist.
ठीक है? So our role may continue to evolve and change, but I don't think there's any danger कि radiologist घर बैठ के और तालियां बजाएगा. ऐसा नहीं होने वाला है.
तो सर
नंबर
एक इम्पोर्टेंट पॉइंट सर मैं ऐड करता हूँ यहाँ पे बड़ा. मैं जो बोलता हूँ व्हाट इज अ कॉमन पॉइंट दैट आई से टू द स्टूडेंट्स, इफ आई एम गोना स्पेसिफिकली लुक एट द इंडियन सिनेरियो, a computer can never replace a human being in India. I mean, it makes your work slightly more easy, it makes your ability slightly more better, But I mean, if you are good in your field, I mean, there's plenty of opportunity that is available for you, because you are being the best brain of the country or best brain of the society. But it's you have to decide, and you have to be the master of all those parts, and you have to be a leader in that.
Absolutely. And here I will say, रेडियोलॉजिस्ट बन के आप ये भूलने की कोशिश नहीं करें कि आप डॉक्टर थे, आपने डॉक्टरी की है. You wanted to treat patients, you wanted to heal patients, and you want to be part and parcel of the entire treatment process. And so for that, don't forget your passion. We radiologists are equally passionate. अब देखो रजत लगा रहता है सुबह से शाम. It is because of the passion. Whereas what I've seen, in some radiologists is कि बस हम तो रेडियोलॉजी में आए थे, 6 घंटे काम करेंगे. 6 घंटे काम करोगे तो भैया फिर दिक्कत होने वाली है आगे चल के. क्योंकि देखिए, जो न्यूरोलॉजिस्ट है वो अपनी फील्ड का, अगर एआई के साथ उसको सीटी पढ़ना आ गया, उसको एमआरआई पढ़ना आ गया, तो अगर आप है ही नहीं तो आपकी क्या जरूरत समझेगा. हाँ, 10-20% टफ केसेस आपके पास भेज देगा. सो इट इज अ वाटरशेड मोमेंट फॉर रेडियोलॉजिस्ट. ये नहीं है कि आपकी जरूरत नहीं रहेगी, बट यू हैव टू बी equally hardworking, you have to be equally passionate, you have to be part and parcel of the entire treating team. तब कोई चक्कर ही नहीं है. एंड देन अल्ट्रासाउंड इज स्टिल वेरी वेरी ऑपरेटर डिपेंडेंट. अगर आप अल्ट्रासाउंड में अच्छे हैं तो आज भी आप हीरो बन सकते हैं. CT/MR में इतना फर्क नहीं है बिटवीन द एवरेज एंड द गुड. मे बी बिटवीन द गुड एंड द बेस्ट फर्क है, बट बेस्ट कितने होते हैं? यू कैन काउंट देम ऑन योर फिंगर टिप्स. वेयर एज इन अल्ट्रासाउंड, if you become very very good, just ultrasound may be enough to take you through life and do very very well. Similar is the case with interventional radiology. That is also something where you are also treating. बट अगर आप ये सोचेंगे कि मैंने तो प्रोसीजर कर दिया, अब ये मैंने लिवर में प्रोसीजर किया था, अब तो गैस्ट्रोएंट्रोलॉजिस्ट या जीआई सर्जन इसको झेलेगा, तो दैट्स द रॉन्ग अप्रोच. You have to take responsibility for the treatment. You have to consider कि ये मेरा मरीज है. उस चीज से आप चलेंगे. देखिए 80s में, लेट 80s में, आई यूज्ड टू बी इंटरवेंशनल रेडियोलॉजिस्ट. पीजीआई से जो भी निकलता है वो इंटरवेंशन उसको आता ही आता है. सिमिलर इज द केस आई नो विद ऑल इंडिया इंस्टीट्यूट टुडे. Similar is the case with KEM and several other institutions. So that is also a subset of radiology, but you have to be dedicated, you have to run. आप ये नहीं कह सकते रात को मरीज आया तो नहीं जी मैं सुबह आऊँगा, मेरा तो 8 बजे से टाइम शुरू होता है. So these things you have to be well aware of. And in fact, if you are a clinical radiologist, you're as much responsible as any other clinician. Why should you think that you are an armchair radiologist? So you have to differentiate between an armchair radiologist and a clinical radiologist. And radiology में कोई कमी नहीं है. रेडियोलॉजी में काम ही काम है. रेडियोलॉजी का काम बढ़ना ही है. आज की डेट में रेडियोलॉजी के बिना कोई ट्रीटमेंट शुरू ही नहीं होता फॉर इवन अ मॉडरेट लेवल ऑफ डिजीज. दैट आई कैन टेल यू.
So, sir, I mean, there are 2 points that are coming up, which students are also asking me on the YouTube channel. And that is like you mentioned about AIMS, resident from PGI. We know that these are the top institutes, but everybody is not fortunate enough to go into the top institutes. And there are so many colleges that are offering radiology. We know that there are some limited challenges that are there at different places. Then nowadays, in the older time, the DNB courses were not structured, but now they have become very, very structured programs. And most of the students who are entering into the DNB programs are also entering through the entrance exams, which was not there 15 years back. So as a person who is taking up so many radiologists, I just wanted to ask you again a very, very straightforward question. A student has come to you who has done his MD from All India Institute of Medical Sciences. A student has done his MD from Maulana Azad Medical College. A student has done his MD from a peripheral college. And a student has done a DNB program. You do not know any of them. these four, let's say these four CVs have come to you. You want to take up 2 radiologists with you. So what all qualities that does that matter to you, that from which institute that person has done without even talking to that person? Or it does not matter? Or if it matters, how much it matters? Do you really want to check? Or does it give you a feeling कि यार ये peripheral medical college से है तो ये तो बेकार ही होगा, और ये ऑल इंडिया इंस्टीट्यूट ऑफ मेडिकल साइंसेज से है तो ये पक्का ही अच्छा होगा, या ये डीएनबी है तो चलो इसको मैं नीचे लिस्ट में रख दूं, या you want, or what is your initial impression and what is your impression that comes after some time? I mean, this is a very straightforward question, which I feel that the student
No, I'll give you a straightforward and true answer, honest answer. देखिए, डीएनबी और एमडी के बीच में आई डोंट थिंक देयर इज एनी डिफरेंस नाउ, बिकॉज students are coming through the NEET exam. They are choosing, and I know of students who've chosen a good institution to do DNB rather than go to some, very peripheral. I mean, periphery be, please, when I take these 3-4 names, it doesn't mean periphery is also a very, very wide word. ठीक है? So between MD and DNB कोई ऐसा फर्क नहीं है. It is more, and I think frankly it is easier to pass in MD. It is tougher to pass in DNB. Okay, and मैं DNB examiner भी रहा हूँ, so I can tell you
that is a challenge that the student have. They feel that it is difficult to pass DNB, so let's not take DNB.
I'll tell you, the pass percentages have increased tremendously ever since NEET has come in. पहले क्या होता था, भाई भतीजावाद होता था, ये मेरा भाई है, ये उस डॉक्टर का बेटा है, उसकी बेटी है, तो ऐसे वो सिलेक्ट होते थे. Ever since NEET has come, these kids are more dedicated, and if you see the pass percentage still being low, it is because वो repeater आते हैं. Those repeaters who had got in through Sifarish are the ones who the pass percentages have improved tremendously.
Sir, इसको clear करते हैं. What is the meaning of peripheral college for you?
Peripheral college for me,
who does not have facility, like who does
not have facility. Yes,
so that's broadly your point.
That is what is peripheral college for me, and that peripheral college may be even in Delhi.
Yeah. So your
Delhi आपको पता है. I won't take the name. There are colleges giving MD radiology, radio diagnosis, who don't have a MRI. ठीक है ना?
Access to the equipment.
Absolutely, equipment and teaching. So, frankly, we have people from All India Institute, PGI, KEM, Rohtak, Ahmedabad, Baroda. So, ultimately, I'll be very frank. कोई All India Institute, MAMC, KEM यहाँ से होता है, and I can talk of Rohtak, Ahmedabad,
maybe SMS.
Yes, colleges in SMS, Bangalore. There would be at least 50-60 colleges जिनका नाम जब आता है तो definitely those children are looked at with a separate kind of view. इसमें कोई doubt नहीं है. ठीक है? But after that, because we take only after 3 years of senior residency, उससे पहले हम लेते नहीं है. Then it comes to कि senior residency कहाँ से की है. And I tell you, and I tell these boys and girls, senior residency करनी बहुत जरूरी है. And if possible, do it from a government institution, because वहाँ आपको free hand मिलता है. प्राइवेट इंस्टीट्यूशन में इतना फ्री हैंड आपको नहीं मिलता है. एंड दैट इज बिकॉज बाय एंड लार्ज कुछ गलती होती है तो कोर्ट केस हो जाता है, या अकाउंटेबिलिटी इज मोर इन प्राइवेट इंस्टीट्यूशंस बिकॉज दे चार्ज मनी. सो सीनियर रेजिडेंसी करना भी बहुत जरूरी है. एंड सीनियर रेजिडेंसी आप ऐसी जगह से देखिए जहाँ इक्विपमेंट भी अच्छा हो सकता है आप ऐसी इंस्टीट्यूशन में थे जहाँ पूरी इक्विपमेंट नहीं थी या इक्विपमेंट इतनी अच्छी नहीं थी, बट देन सीनियर रेजिडेंसी में उसको मेकअप करिए. एंड देन एट द एंड ऑफ इट इज आपका अपना परिश्रम, हार्डवर्क, आपने कितना सीखा, कितना आपको आता है, कितना आप में कॉन्फिडेंस है, कितना आप हार्डवर्क करना चाहते हैं. देखिए कोई भी सिखाया तो आया नहीं. मैंने भी जब एमआरआई करना शुरू किया, मैं 1 साल फेलोशिप करके आया था ह्यूस्टन से, और यहाँ के तो शुरू से ही किया. सो इट इज अ ongoing लर्निंग प्रोसेस, एंड इफ यू आर हार्ड वर्किंग एंड सिंसियर, दैट इज वन वर्ड विच आई यूज ऑल द टाइम, सिंसेरिटी. जो सिंसियर है उसको काम आज नहीं आता तो आ ही जाएगा. एंड ये भी मैं कह दूं, बड़े से बड़े इंस्टीट्यूशन से भी जब कोई नया ज्वाइन करता है तो 3 एक महीने तो हम रिपोर्टें देखते हैं कि भैया, एंड स्पेशली प्लेन एक्सरे की रिपोर्टें तो देखनी ही पड़ती हैं, बिकॉज 3 साल सीनियर रेजिडेंसी के बाद भी उसमें ऐसे ऐसे कई बार गलती हो जाती है विच इज यू वंडर कि ये कैसे हो गया. एंड CT MR, ये वो those are more glamorous things, बट आपको कन्वेंशनल आता होगा तो वो चीजें आप बेटर कर सकते हैं. ये तो रजत आप जानते हो, आप भी कहते रहते हो, ठीक है ना. बट वो इतना सेक्सी नहीं है, इफ आई यूज दैट वर्ड. बट आई थिंक क्रॉस सेक्शनल इमेजिंग इज वन थिंग दैट विल बी earliest impacted by AI. ठीक है.
Radiology is the ultrasound is the biggest charm in the radiology, that I always say to the
Sound, interventional radiology, CT/MR, X-ray, everything, bariums, angiographies, embolizations, it really depends कि आप कितना काम करते हो. मतलब आई रिमेंबर आफ्टर ऑल इंडिया इंस्टीट्यूट, आफ्टर माई फेलोशिप, मेरे को वापस अमेरिका से वापस आया, नौकरी नहीं मिली, तो RML हॉस्पिटल गया जहाँ पे कैथ लैब भी थी, वहाँ पे हमने इतना इंटरवेंशन किया. सो इट इज ऑल्सो योर ओन इनिशिएटिव, एंड देन हाउ मच योर सीनियर्स लेट यू डू, दैट इज ऑल्सो वेरी इंपॉर्टेंट. पर अगर आपको फ्री हैंड मिलता है, आप सब कुछ करिए, क्यों नहीं. हम भी तो कभी बच्चे ही थे, हमने भी गलतियां करके ही सीखे हैं. पर सीखने की एक लगन होनी चाहिए, एक मज़ा आना चाहिए अच्छा डायग्नोसिस बनाने में, एक मज़ा आना चाहिए PT/BD करने में, एक मज़ा आना चाहिए मरीज़ आपको दुआएं दे के जाए, एक मज़ा आना चाहिए आपका क्लिनिकल कॉलीग फ़ोन करके आपको बोले कि बॉस आपने जैसे बताया था वैसा ही निकला सर्जरी पे. सो हमें तो, बट अगर आप कहो कि आप उतने पैसे कमा पाएंगे जितना आपका क्लिनिकल कॉलीग कमाता है, तो द आंसर इज नो. एंड प्लीज रिमेंबर दिस, जो सर्जन है जो बेस्ट बन जाता है, जो फिजिशियन है, गैस्ट्रोएंटरोलॉजिस्ट है, न्यूरोलॉजिस्ट है, जो बेस्ट बन जाता है, और याद रखिए ये सुबह से रात काम करता है, ये घर 10 बजे ही पहुंचता है. अगर आपने 6 बजे पहुंचना है तो यू विल नेवर बी एबल टू, बिकॉज आजकल ये फाइनेंशियल चीज भी बहुत बढ़ गई है. So you will never be able to earn as much as they do. Okay?
Sir,
but they have different kind of tensions, and they have different kinds of work environment and working timings. So if you think कि radiology में पैसे बहुत बनेंगे, तो you will never be able to compete with your clinical colleagues who are in practice. हाँ, अगर आप गवर्नमेंट में काम करते हैं तो everyone earns the same, but in private practice आप अल्ट्रासाउंड लगा के करते हैं, और आप अगर बहुत अच्छे हो गए, then maybe you can compete on the financial side also with your clinical colleagues, but clinical people will always do better. But then if you want to become an entrepreneur, आप अपना करना चाहते हैं, तो then remember, you're earning money for what you're doing as a radiologist, plus you're earning money because you took the initiative and you started this startup or business, and you're earning because of that. In a diagnostic field, it is easier to become an entrepreneur. And in fact, मैं तो हर एक को कहता हूँ, my parents were both teachers, और हमारे तो business का कोई आगे पीछे कोई था ही नहीं. And I say, if I could do it, and in the early 90s, जबकि लोन लेना इतना मुश्किल होता था, जब स्टार्टअप नाम ही नहीं था, मेरे को कहते थे कि ये डॉक्टर है साथ में बिजनेस भी करता है, मेरे को बहुत बुरा लगता था, वो वर्ड चुभता था. अब तो इसका नाम हो गया स्टार्टअप, इतना बढ़िया नाम है, इतना एलिगेंट नाम है. सो in radiology, it is much easier to become an entrepreneur
Yeah.
than it is in the clinical fields. And for those who want to do that, the sky is the limit.
So, sir, I mean, मैं थोड़ा summarize करूंगा जो आपने, I think the entire crux of the radiology that you have given. So, first of all, sir, please correct me if you feel that I am wrong somewhere.
Sure,
First of all, guys, those who want to pick up radiology, what is sir's suggestion, which is my suggestion also, that if you get a top brand college, take it up because that matters. The brand definitely matters. There is no doubt about it. You get the top college of your state, irrespective of the state that you are in. You get a top college of your state, take it.
I agree 100%.
If you are not getting the top college of your state, then it matters. You see that whichever college that you are taking up, what are the facilities that are available in that particular college? Whether a functioning CT scan is there or not, whether a functioning MRI is there or not, because radiology is all about technology. If you do not get the access of this technology, there is no point taking up the seat in that. Try to move from your own state to another state. If in your state you get a DNB program, look at the DNB program. If the access to the modalities is there, is this DNB program only just for the purpose of getting a doctor for the night shift, or it is a genuine proper program like Gangaram Hospital, like Nanavati Hinduja Hospital, which have a well-established structured program that are there. So this is an order that should be kept nowadays. Now, let us say that you are still dedicated, you want to take up radiology, but you are not having a privilege of taking up a top college or taking up a college who has got these equipments. Then you have to be really very much determined that you want to learn it, because ultimately it depends on the person. Then, as sir has suggested, that all we are limiting ourselves only to the 3 year of the residency, but there is a big component of that is a 3 year of senior residency also. When he is taking up a radiologist, he is looking into this, the kind of experience that the person has. So if you think that because of whatever reason, there is some lag that has happened in your residency, try to compensate it with the senior residency. Let's say that you have not learned a good MRI at that point of time, then try to compensate it. Okay. IR, I have a view about the IR is that IR is a separate aspect of the radiology altogether. And you have to be very, very clear that whether you want to be a diagnostic radiologist or whether you want to be an intervention radiology.
One can be a bit of both also, Rajat. There's nothing.
Vascular intervention, I feel, has now gone completely separate.
ऐसा लगता है in the larger hospitals where actually the volumes are so high, 500, 700, 1000, 2000 बेड का हॉस्पिटल है, वहाँ वॉल्यूम इतने हैं that you have enough work for interventions. Whereas in a 200 bed hospital, in a 150 bed hospital, the radiologist may have to do both diagnostic as well as interventional radiology. And even we are in some hospitals also, and there, someone who's more interested in interventional radiology, but अगर रोज का एक केस होगा तो वो क्या करेगा? So I don't think these two things are exclusive of each other. Depending on which institution you actually go in, and depending on the volume of work, you may become exclusively interventional radiologist, but still you will need your diagnostic radiology competence and knowledge, or you remain a mix of both. Frankly, if you ask me, in the majority of medium level hospitals, it's a mix of both.
And sir, there is a question that I have got. In this world where everybody is doing subspecialization, fellowships also, how important do you feel is to do the subspecialization in the radiology? I mean, are you seeing a future in when a general radiologist will not be accepted in the society, like an MBBS doctor is no longer accepted? Or do you think that there will be a scope for both the fields with fellowship trained radiologist as well as a non-fellowship trained radiologist?
I think the analogy should be with MD medicine rather than with MBBS.
MD medicine, yeah.
What, again, it depends on the size of the hospital and the kind of work. What I've seen is that there are large hospitals where you have, say, a department with 15 radiologists, 10 radiologists, then subspecialization works. But most of the hospitals in our country are those which will have 3, 4, 5 radiologists, where the generalist who knows, about all modalities, because everyone wants to rotate in every modality. उसको MR भी करना है, CT भी करना है, अल्ट्रासाउंड भी करना है, थोड़ा बहुत इंटरवेंशन भी करना है, प्लेन फिल्म भी करना है. So I think super specialization has limited takers in our country because the large hospitals or even the super specialist hospitals are limited.
Yeah, unless you're going to a big corporate hospital, that is your thought, or an academic institute like SGPCI or all these.
There also, it's still in its infancy.
Yeah.
Okay.
So there is a big scope of general radiology as of now.
It will remain, and as it evolves, you will also grow, and you may pick and choose a field depending on your own interest and the need of your hospital. So I don't think, in fact, many boys and girls who've specialized in say a neuroradiology and intervention hota nahi hai, then CTMR, brain and spine, what is the big deal that you've learnt in neuro fellowship, and आप अपना अल्ट्रासाउंड भूल गए, आप एंटीनेटल अल्ट्रासाउंड तो बिल्कुल ही आपके हाथ पैर फूलते हैं. सो देन द एम्प्लॉयबिलिटी एट टाइम्स हैव आल्सो गॉन डाउन. सो till such time that our healthcare system evolves in a way that there is a huge need for super specialists, and hota bhi kya hai, we've seen this trend towards musculoskeletal fellowships, and everyone wants to do musculoskeletal fellowship. तो उसमें क्या होगा, 3 साल बाद सारे आपको there'll be a glut of musculoskeletal guys जो कि फिर दूसरी चीजें अपनी भूल जाएंगे. So remember to evolve as you're going forward, and you must know everything, and also know general radiology, because that's the starting point. That's your foundation on which everything else is going to be built. And a chest x-ray, उसको तो मरीज का रिश्तेदार भी देख रहा होता है और पॉइंट आउट कर रहा होता है ये खराबी है. And for the radiologist, it's the toughest thing. Even for the senior most radiologist, it's the toughest thing. You can miss something. So please concentrate on all aspects, and as you grow in the profession, you will evolve and decide what you are better at, what you enjoy doing more, and what is the scope in the clinical environment wherever you practice, in which part of the country or the world you practice. And do remember, the world is an open field right now. इंग्लैंड वाले तो हाथ जोड़ रहे हैं कि इंडियन रेडियोलॉजिस्ट आए, बट इंग्लैंड वालों की एक गलत बात है, उन्होंने हम पे राज किया कि वो 3 साल के लिए या 5 साल के लिए देते हैं, फिर कहते हैं नमस्ते जी, फिर कहाँ जाएंगे, फिर यहाँ आके स्ट्रगल करेंगे क्या. So, but there is a lot that is possible. There's teleradiology also. It's growing as a field. How it will evolve over time, I feel it will be helped by artificial intelligence. So there's huge scope of radiology. I don't see radiologists becoming redundant or sitting at home.
Sir, thank you very much, and I'm sorry I'm taking those uncomfortable questions.
No, there's nothing.
Another uncomfortable question I will take for you.
I say the truth, yeah. मेरे को कोई discomfort नहीं है.
एक और क्वेश्चन है सर, because you interact with radiologists also, and you interact with a lot of non-radiologists also in your routine life. So Vivek and Adarsh both have asked a nearly similar question. Let us say that I am planning to do intervention radiology, and I just want to do a core intervention radiology. So if I talk about an intervention radiologist, nowadays neurosurgeons are also doing neurointervention. Cardiologists are also doing vascular interventions. Then there are vascular surgeons who are completely into intervention, vascular interventions.
Yes.
So how do you see a difference between a radiologist who is practicing interventions versus these fields who are doing, because they are the primary physician. Ultimately, the patient is directly coming to them. So if I have a thought that I want to do the intervention radiology, because right now I am at a place where I can take up whichever branch that I want. So rather than taking up intervention radiology, why don't I take up MD medicine and going into these branches directly and becoming a primary physician, or taking up this particular route that going a radiology and then doing the intervention radiology and still becoming a secondary physician who is dependent on taking the referral from these people. So what's your viewpoint on this?
This is a very, very good question. And I'll tell you, I said I was an interventional radiologist in the late 80s. Actually, I'd gone to MD Anderson Cancer Hospital for an interventional radiology fellowship in 1987. And there, MRI had just been installed. MD Anderson, as you know, is the largest cancer hospital in the world. And I got fascinated with MR, and somehow I switched and, became a MR radiologist. But these tough battles are very real. These tough battles are there right now, and they will only become stronger. But some institutions where radiologists have been strong, they actually now even do OPDs of interventional radiology. So the patient comes directly to them. So it just depends on how, actually, as a junior, you can't have that, thing that you can take a decision in a hospital. So you will have to pick and choose the institutions where interventional radiology is very, very strong, where the numbers are high, and where, if possible, you have OPD also. Now I know for neurointerventions in All India Institute, they have an OPD of their own. In PGI Chandigarh, they have an OPD of their own. Medanta Hospital, it's so large, it has so much of work that वो gastroenterologist को time ही नहीं है कि वो करे. So, but these tough battles are very real. After all, it's a matter of training. If a neurosurgeon or a neurologist gets trained in neurointerventions, and if legally he's allowed to do that, I know that the Indian Society of Neuroradiology is in court against this fellowship, but the court didn't state. Abhi bhi wo case chal raha hai. Similar is the case, you will have to fight your battles. That's why I say that you will have to evolve in the healthcare system. ये नहीं है कि मैं तो यही बनना चाहता हूँ और यही करूँगा, मैं तो रिपोर्ट लिखूंगा ही नहीं. ऐसा आप एटीट्यूड एटलीस्ट एट दिस स्टेज ऑफ लाइफ नहीं लीजिए. 5 साल 10 साल में ये सारी फील्ड्स इवॉल्व होंगी, एंड देन यू कैन फाइन ट्यून योर अप्रोच विद द टाइम. बट ये बैटल है. जो भी प्रोसीजर ड्रिवन ब्रांचेस हैं और जहाँ क्लिनिशियन है, वो द रियलिटी इज कि आज की डेट में मरीज उन्हीं के पास पहले जाता है, और अगर उन्हीं ने करना सीख लिया या उनके जूनियर्स ने करना सीख लिया, and if laws permit it, then there is nothing that you can do. The same thing is happening in ultrasound. Why intervention? See, in his or her own specialty, every specialist is permitted by law to do ultrasound and consequently also ultrasound guided procedures. आप ये नहीं कह सकते कि ये रेडियोलॉजिस्ट के लिए ही है. ऑफ कोर्स वी आर इन द सुप्रीम कोर्ट अगेंस्ट दिस. IRIA is in the Supreme Court against this, but the law as it exists today, and I don't think for the specialists it will change. आज की डेट में तो ये भी है कि MBBS 6 महीने की ट्रेनिंग करके अल्ट्रासाउंड कर सकता है. They will also be your competitors as they are. So you should know all of this. But एक बात मैं कहूँगा, अगर आप में लगन है, अगर आप हार्ड वर्क करने को तैयार हो, अगर आप अपना सब्जेक्ट जानते हो, then the sky is the limit, irrespective of what the competition is or is not.
So 2 points बोलूँगा यहाँ पे, just to update you that I have started my OPD of diagnostic radiology, not the intervention radiology, in the Primus Hospital, where people will directly come to me and I am going to give them. This is a new trend that I am trying to start. very recently, I have started this where I want people to come, because I always believe that everything is dependent on the radiology nowadays. So let people come with to me, and I'm gonna prescribe, because ultimately the diagnosis to radiology bhi banna hai. So let me be the primary physician and let me guide them that which investigation has to be done, and then let me do the investigation, let me get the diagnosis, and then let me give it to my colleague, a gastroenterologist or a neurologist to go. I'm trying to do it an experiment basis
देखो रजत,
in one form.
anyone who has done MBBS can run an OPD
Yeah,
under the laws of the land.
that's what I'm
So
trying,
this
sir.
is a great experiment that you're doing, and so many times patients ring us up कि सर
Yeah.
ये प्रॉब्लम है, ये है, तो क्या करें, कैसे कराएं, हम पहले डॉक्टर को दिखाएं, पहले ये नी में इंजरी हुई है, पहले एमआरआई करा ले. सो इन आवर ओन स्मॉल वे we are doing it. Every radiologist does it. I'm glad you've taken this initiative to do it formally, and I hope this can be a harbinger of change to come. पर 6 बजे घर नहीं जा पाओगे भैया.
सर हम तो शाम को 10 बजे भी नहीं जाते सर.
हाँ, 6 बजे घर नहीं जा पाओगे. ठीक है. तो ये जो बच्चे सुन रहे हैं, अगर उनके दिल में ये है कि हम 5 बजे घर जाएं, 4 बजे घर जाएं, 4 घंटे काम करेंगे, बाकी घर से करेंगे, तो ये कहानी शायद 3 साल चले, 5 साल चले, 10 साल चले. आपकी लाइफ अभी शुरू हुई है. 6 साल तो आपने पढ़ना ही है, 3 साल एमडी के हो गए, 3 साल सीनियर रेजिडेंसी के हो गए. तो आपके तो अर्ली प्रैक्टिस में ही कुछ चेंजेस ऐसे आएंगे कि आपको परिश्रम, हार्ड वर्क करना पड़ेगा. एंड लेट मी कम टू वन अदर थिंग विच आई वाज टोल्ड व्हेन आई जॉइंड प्रैक्टिस आफ्टर after my senior residency. As you know, I worked 2 years as a scientist C in DRDO at INMAS, which had got India's first MRI scanner. So मेरे को जब मैं प्रैक्टिस में आया तो किसी ने समझाया ABC ऑफ प्रैक्टिस. एंड व्हाट इज इट?
Availability, behavior, competence.
A they say is availability. वो कहते हैं कि you may be the best doctor in the world. अगर आप मरीज को जब आपकी जरूरत है आप हो ही नहीं. एंड दिस डजंट अप्लाई ओनली टू रेडियोलॉजी, दिस अप्लाइज टू medical practice as a whole. A is availability. You have to be available when the patient needs you. If you're not there, आप चाहे दुनिया के बेस्ट सर्जन हो, मरीज को क्या फर्क पड़ा. B is behavior. आपका बोलचाल बहुत अच्छी होनी चाहिए. वो दिन गए जबकि डॉक्टर डांटते थे और इतने बड़े डॉक्टर होते थे कि कोई फर्क नहीं पड़ता था. बिहेवियर मैटर्स. इन एनी केस आपको you have to be well behaved, you have to empathize with the patient, you have to talk to him and listen to him. And C is competence. And I was told it is in this order. सबसे important availability, उसके बाद behavior, C is your competence. That comes number 3. So, and in my now 31 years of practice, I would agree with this. Of course, competence is very, very important. And today the patient has recourse to so many kinds of courts and kacharis, and जहाँ वो complain कर सकता है आपका, if you make a mistake. So we are all human, we make mistakes. And the fourth thing I would say is communication. You communicate with the patient.
Sir, I have a very important point for you here.
Yeah,
You are
communicate
such an
with
influential, sir, you are such an influential person. I mean, you know each and everybody. Why don't you put this suggestion to the government of introducing behavioral skills, communication skills in the undergraduation? I mean, you are a person who can put this. I mean,
Rajat, I've done that. Not only that, also ethics. Okay?
Yeah, exactly. So, I mean,
which is so very important. And we've also said teach them about financing.
Yeah.
Because इनमें से कई लोग अपनी क्लिनिक बनाएंगे, नॉट ओनली रेडियोलॉजी. इनमें से कोई सर्जन, गायनेकोलॉजिस्ट मिलके एक नर्सिंग होम शुरू करेंगे. इनमें कई लोग अपना अल्ट्रासाउंड शुरू करेंगे. इनमें कई लोग पैथोलॉजी लैब लगाएंगे. कई लोग डायग्नोस्टिक सेंटर लगाएंगे. सो एज यू नो, I've been the president of the Indian Radiological and Imaging Association. I've been president of the Indian Society of Neuroradiology. And as the president of the Healthcare Federation of India, Nat Health, which spans not only, hospitals and diagnostic centers, but also the manufacturers, GE, Siemens, Philips, Indian manufacturers, Alengers, BPL, My Lab, कितनों ने अभी ये वैक्सीन वाले हैं, then home health, telehealth, health insurance, even investors. It spans all of that. During this time, we have interacted very closely with the government, and currently I'm the chairman of the FICCI, Health Services Committee. FICCI is the Federation of Indian Chambers of Commerce and Industry. So we interact with the government and we are telling them to bring this in the course curriculum. क्योंकि हमने तो हिट एंड ट्रायल मेथड से सीखा. हमने किसी ने कुछ बोला तो आई स्टिल रिमेम्बर वन ऑफ माय अंकल्स टेलिंग मी, जब उस जमाने में 1990 में 2.5 करोड़ का लोन लिया तो करोड़ तो शब्द नहीं निकलता था मुंह से. वो लखपतियों का जमाना था, 1 लाख की लॉटरी निकलती थी. तो ही टोल्ड मी, डॉक्टर साहब आप लोन तो ले रहे हैं, पर याद रखिए आपकी मशीन तो कुछ घंटे चलेगी, पर लोन का मीटर जो है वो 24 घंटे चलता है. It was very scary, I can tell you. But now these kids are much better off. You have internet, you have access to all of us. And it's become a very small world. And these people are so much more knowledgeable. And India is a much more open society, much more economically evolved society. But we have, Rajat, as you say, we are interacting with the government, telling them, आप यार उसके 5 लेक्चर रख दो, पर रखो तो सही.
Yeah.
And I'm sure our request will be acceded to.
Yeah, thank you very much, sir, for this. And sir, एक point again थोड़ा सा touchy point है. MD हो गया, DNB हो गया, good medical college हो गया, state medical college हो गया, peripheral medical college हो गया. There are people who wants to do radiology, and I feel that anybody who has thought of doing a radiology, they should do radiology, but they are not getting it. But now we have got DMRD. We have got now this new course start by the national board as a diploma of the national board. Not DNB, diploma of the national board, which is a 2-year program.
DMRD तो खत्म कर दिया उन्होंने.
है ना, हाँ. तो again, what is your viewpoint about?
Again, I'll say it depends on your competence, your training, your skills, your hard work.
They should take. They can take it. It's not like that. They can take.
Even in our system, we have DNBs, we have MDs, we have DMRDs. Of course, diploma तो ये diploma जो नया है, ये तो नया है. But ultimately, आपकी लगन, आपकी competence, आपकी knowledge, that is what matters. As long as this diploma doesn't limit you in any way.
एक level पे बराबर हो जाता है. So एक level के बाद, once you see that that person is doing well, it does not matter to you कि वो DMRD है कि वो DNB है.
देखिए, similar thing is in pathology. DCP has been there for so long. तो उसी मेडिकल कॉलेज में अगर किसी ने DCP किया है as compared to MD, क्या फर्क पड़ता है? DCP या DMRD के बाद भी आपको सीनियर रेजिडेंसी मिलती है, उसके बाद भी आप प्रोफेसर बन सकते हैं. तो मेरे हिसाब से कोई ऐसी it's your knowledge and your skill that will matter at the end of the day, and nothing else, as long as you're legally allowed to practice.
तो सर एक स्टूडेंट ने क्वेश्चन पूछा है. शी इज ऑलरेडी अ फर्स्ट ईयर रेडियोलॉजी रेजिडेंट एंड शी हैज पिक्ड अप रेडियोलॉजी थिंकिंग दैट द कॉलेज इज गुड, but unfortunately she is stuck with the college which does not have good academics and neither good infrastructure. What they should do, sir?
No, I'll say please don't change. There's no need to change. जो आप वहाँ सीखते हैं आप सीखिए अपने स्पेयर टाइम में. आजकल तो सब कुछ ऑनलाइन भी है. इतने कोर्सेज, IRIA, ICRI, हजारों कोर्स हो रहे हैं. हमारे टाइम तो कुछ नहीं होता था. You can learn. ऐसी कोई बात नहीं है. And then in whichever city you are, ये कॉलेज अच्छा नहीं होगा या हॉस्पिटल अच्छा नहीं होगा, कोई और होंगे. आप वहां चले जाओ, 2 घंटे बिताओ ट्वाइस अ वीक। हमारे पास कई लोग आते हैं जिनके यहाँ एमआरआई अच्छा नहीं है, तो दे कम इन द इवनिंग एंड स्पेंड टाइम। यू शुड बी विलिंग टू स्पेंड टाइम। अ हॉस्पिटल और इवन अ प्राइवेट डायग्नोस्टिक सेंटर, आई एम श्योर विल वैल्यू योर प्रेजेंस। और अगर आप दिल्ली में हैं तो आप हमारे पास आ जाइए। हम तो आपको पता है 20 साल से न्यूक्लियर मेडिसिन की डीएनबी करा रहे हैं। 7-8 साल हमने एक बड़े हॉस्पिटल में रेडियोलॉजी की डीएनबी कराई। सो अगर आप सीखना चाहते हैं, डोंट वरी, आप ऑनलाइन सीखिए, आप अपने दूसरे हॉस्पिटलों से सीखिए। सीखने के तरीके तो बहुत हैं।
Or maybe, sir, they are giving me another point which I can start for a student like we do at MBBS undergraduate teaching. So let us come up with some courses for
यार
the
आईसीआरआई,
postgraduate resident
I
also.
tell you, Rajat, ICRI is doing yeoman service to these postgraduates. ऐसा कभी हुआ ही नहीं। दिस इज द सिल्वर लाइनिंग ऑफ द पैंडेमिक। पैंडेमिक में ये कोर्सेज शुरू हुए एंड वी, आर नेम इज गोइंग टू कम इन द गिनेस बुक ऑफ वर्ल्ड रिकॉर्ड्स कि रोज एक कोर्स हुआ है,
Yeah.
रोज एक वेबिनार हुआ है।
I have been also part slightly for that, sir.
यस यस,
Yeah.
कई वेबिनार्स में मैं भी पार्ट लिया है। सो
You are तो a part of the managing committee.
नहीं नहीं नहीं, वो यार
You are the brain behind it.
पढ़ाने में भी मजा आता है। सो डोंट वरी ऑन दैट स्कोर। और अगर आप ज्यादा लगन दिखाओगे, आप 8 बजे के बाद कर लो ना, रात में अल्ट्रासाउंड तो होएगी। जो चीजें हैं उनमें आप एक्सपर्ट बन जाओ।
Yeah. Sir, I have two more questions for you. One is, I do not know in an open platform how relevant this question is, but I think I can ask you anything. What is a standard basic salary of a radiologist in a private setup? At what level usually these people start? And what is an upper limit where they can go if they consider themselves a 9 to 5?
Today I'll tell you, the start is for a good person who's done 3 years and again, the salaries vary. If you want to go to a small town, you'll get much more money. If you want to be in Delhi, Bombay, Bangalore, Chennai, Kolkata, it'll be lesser. क्योंकि छोटी जगह कोई जाना नहीं चाहता। तो and this is not only for radiologists, this is for all specialists. I would say that in a city like Delhi, if you've done your 3 years of senior residency and you're good, then anywhere between 2.5 to 3 lakhs you will start per month. The best radiologists of the country will get probably 6.5 lakhs a month. And I think that by and large, unless there are some corporate hospitals where the HOD may get something more. बट ये है, तभी मैं कहता हूं कि आप अगर सोचते हैं कि रेडियोलॉजी में पैसा है, तो वैसा नहीं है। ठीक है, वो तभी है अगर आप एंटरप्रेन्योर भी बनेंगे। ठीक है, या आई एम श्योर द इंटरवेंशनल रेडियोलॉजिस्ट हु आर इन बिग इंस्टीट्यूशंस और जो सुबह से शाम काम कर रहे हैं, they will earn what the surgeons earn or nearly what the surgeons earn. Otherwise, this is the salary structure.
Yeah, sir, there is a student.
And this is for 8 to 9 hours of working. This is for कि Sunday by rotation होगा और आप कुछ समय के लिए आएंगे and night by rotation होगी in a hospital.
Yeah, so I mean 2.5 to 6 lakhs is a usual bracket that is there for the radiology. So there is a student who has asked, if we are tech savvy and have basic coding skills, is there a place to add value in the AI space? Innovation seems to be limited to machine learning and data scientists.
Fantastic question.
So what's your view on this?
In fact, you will be better. You will be better than any data scientist if you do data science after your radiology. And this is a huge field. मतलब ये एक ऐसी फील्ड है। See, my own son, let me give you his example. His name is Vidur and he wanted to go to मौलाना आज़ाद, but उसका ऑल इंडिया रैंक 300 आया और ये काफ़ी साल की बात है, तो उसको मौलाना आज़ाद नहीं मिला। तो देन ही सेड मैं बॉम्बे जाऊंगा. बॉम्बे में साइन हॉस्पिटल उसने ज्वाइन किया. उसके बाद उसको रेडियोलॉजी की पीजी भी मिल गई, बट ही केम टू मी एंड सेड कि मैंने रेडियोलॉजी नहीं करनी, मैं एमबीए करूंगा. So he went to America, did his MBA, and came back, worked with us for some time in running the centers, setting up new centers and all of that with his new acquired skills in MBA. And then in 2017, got into AI. 16, 17, 17. 16 में तो वो अपनी MBA करके वापस आया था. So today he works like an engineer, and and I tell you, we have a full-time person in our carpal.ai, and you guys may go online and see carpal.ai, carpl.ai. Dr. Vasanta Venugopal, a fantastic radiologist. He was assistant professor of radiology at Maulana Azad Medical College. Then he left, and today 100% of his work is dedicated to AI. Probably he is the only radiologist spending 100% of his time in AI in the globe, around the world. And there is going to be a huge need for these. And so this is another, and pharmaceutical companies, diagnostic companies, they will have positions for radiologists who also know, who also know data science, who also know coding, and so on and so forth. So that's another huge branch which I'm not even talking about.
Yeah.
That's an evolving branch.
Vasanta is my very, very close friend, sir, from the radiology time, and I have met Vidur a couple of times.
So Vasanta, again, I'll tell the youngsters, he was the first Indian radiologist who practices in India, who at the RSNA, that's the Radiology Society of North America meeting, which is the Mecca of radiology, a meeting held in Chicago every time, stood on a stage which is as big as half a football field, 7,000 person theater, on which Michael Jackson used to sing. He stood on that stage and was the first Indian to give a lecture from there. First Indian from India who gave a lecture there in 2018, I think it was. So, scope तो बहुत है. आपकी लगन, आपकी मेहनत की बात है.
Yeah. No, sir, I mean, it's been amazing, and probably the students who are new into the field, I mean, I, being in the radiology, can imagine that, I mean, it's such a great privilege for all of us that so much time has been given by you to these
It
youngsters.
is fantastic. I mean, these guys, and then you can evolve. I do believe 5-7 साल में ये नई field आएगी. Field of integrated diagnostics. In fact, in this part of the world, last year, we started a center for integrated diagnostics in New Delhi, which was inaugurated by the Honorable Vice President of India at that time, Mr. Venkaiah Naidu. And there we do from hemoglobin all the way up to next gen sequencing, and from X-ray all the way up to PET-CT. Under one roof, we have teaching, training, research, AI, all in one building.
Sir, I want to add one point here, which is owned by a radiologist. I mean, that's a very, very important
मैं तो
point.
सब रेडियोलॉजिस्ट को कहता हूँ कि यार अगर मैं कर पाया तो आप लोग कर सकते हो.
In fact, sir, in this IRIA, I mean, if you remember, we had the session together, but you had to leave, so you did not get time to listen to my talk. So I have spoken about this a lot to the radiologists, and I have told them that enter into this field. It's an amazing field, and if you feel, because I mean, I have also from a background where a lot of things were limited by the financial challenges. If you are willing to work hard into this particular field, I mean, I on personal behalf can assure you that the funds will not be a challenge to you. If you are really ready to work hard,
का कोई challenge नहीं है.
do let me know. I mean, on my personal capacity, I am there to support you. We will do some joint ventures, and we're gonna come. I mean, I launched a fund by the name of FRBR, for radiologists by radiologist. So if any radiologists who want to come forward, if they have these ideas in their mind, do reach out to me. And
Rajat, now that you tell me about this, we are willing to partner. We
yeah.
are willing to partner, and maybe because we've done this for over 30 years, we also know how to do it in a frugal manner, in a manner in which the chance of the project succeeding is much higher.
So, sir, I have a friend who is a venture capitalist. He and me has set up a fund aside of around 10 crore rupees for specifically this FRBR project. But the only criteria is it has to be owned by a radiologist.
Very
It has
good.
to be specifically for the radiologist. If they want to do something, they can reach out to me, and maybe I will reach out to you.
No,
And
funds are not a constraint. जब मेरे तो मैं I'll tell you this is real. मैं इसे बना के नहीं बोल रहा हूँ. जब लोन मुझे मिला और मैं एलसी खुलवा के आया, आई स्टिल रिमेंबर आईएफसीआई का दफ्तर था, उससे सीढ़ियों से मैं उतर रहा था. इट वाज आयरॉनिकल और मे बी दैट वाज फेट कि मेरे जूते का सोल फट गया. सो एक्चुअली जूते घिस गए थे. आज की डेट में तो कोई दिक्कत ही नहीं है.
Rohit, put yourself on mute. Okay, thank you. Yeah. All right. So, I mean that's a wonderful insight, sir. Sir, there is another question that is coming. What is your view on fetal medicine after MD radiodiagnosis?
See, that's you may choose that field, but again, you, I feel, will be able to do a much better job than what a gynecologist can do. Because fetal medicine is about the heart, also about everything, and then the interventions. So it's a great field. See, if there is enough work in your geographical location, in that specific hospital, then you super specialize, sub specialize. Why not? Because you will become better than anyone else. But आपको ये देखना है कि उसकी वहाँ रिक्वायरमेंट है कि नहीं है, ये लेके चलना है. बिकॉज ये नहीं है कि आपने, दिस इज लाइक आई टेल मेनी ऑफ दीज एआई डेवलपर्स ऑल्सो, कि वो एक सोल्यूशन ले आते हैं और फिर वो उसको फिट कर रहे हैं. सर ये हमने बना लिया है, अब हम फिट कर रहे हैं कि किस प्रॉब्लम को सॉल्व करेगा. सो यू हैव टू लुक एट द प्रॉब्लम एंड देन फाइंड अ सोल्यूशन. सो यू हैव टू लुक एट द रिक्वायरमेंट एंड देन डू वॉट एवर. बट देर इज नो डाउट, आप जितना छोटे दायरे में काम करेंगे, जितना आप सुपर स्पेशलाइज करेंगे, आप उतने अच्छे हो जाएंगे. सो इवन फीटल मेडिसिन is a huge field, but do remember, you will get competition again from gynecologists who are doing fetal medicine, but it's a great field.
Okay, yeah, I mean, so that's another opportunity that is
Absolutely.
That is there. And sir, another important aspect about the radiology, which you already mentioned, I will say that radiology is probably one branch where if you have done radiology from India and if you want to settle in any country outside India except US, you can do that without exams.
Absolutely.
For US, probably you have to write USMLE, but otherwise, I mean, all this, if you want to go to Australia.
USMLE भी लिखना पड़ता है आपको जाके, unless you want to do a fellowship and come back like I did. तब तो हमारा ECFMG होता था. तो if you want to actually practice there, their laws are such कि आपको रेजिडेंसी दोबारा करनी पड़ेगी, चाहे आप कितने भी सीनियर हो. बट देन जो आपने काम किया होता है उसका आपको बेनिफिट मिल जाता है.
Yes, yeah. So I mean, you can settle in Australia, you can settle in UK, you can settle it in Middle East, you can settle.
Of course, you have to pass their practice exams. जो भी उनके होते हैं वो तो आपको पास करना ही. वो
But
तो
I
हर
mean,
एक को
that's
पास
the opportunity that is there, which is not there with some of the other branches. But I think there are certain points that you have really mentioned is that ultimately, no matter which branch you are taking up, it's your will and it's your ability and your determination to work hard. I mean, if you want to work like a 9 to 5 job, then just be ready that you're going to have a basic salary of around 2 to 2.5 lakh rupees, which will go to.
हाँ, 9 to 5 में आपको 3 भी मिल जाएगा, छोटे शहर जाएंगे 4 भी मिल जाएगा, और बिल्कुल पेरिफेरी में जाएंगे 5 भी मिल जाएगा, पर वहां आप जाएंगे नहीं.
Yeah. And in a metro city, I mean, from 2.5, you're gonna go up to the 5 lakh or 6 lakh, even in the top of the situation. And preferably go to a good college. I mean, a branded college. But if you're not
देखिए,
getting it,
I would say, again, एक मैं शेर यहाँ बोलता हूँ, frankly कोई फर्क भी नहीं पड़ता, और पड़ता भी है, it is how much you want to learn. और शेर मैं बोलूँगा, and with that I'll end because I have a flight to catch.
I'm so sorry. Upper limit is 3 o'clock, sir. I know that.
शेर ये है, मंजिलें उन्हीं को मिलती हैं। मेरे को एक ही शेर आता है, बट ये मैं सुनाता हूँ। मंजिलें उन्हीं को मिलती हैं जिनके सपनों में जान होती है। मंजिलें उन्हीं को मिलती हैं जिनके सपनों में जान होती है। पंख से कुछ नहीं होता, हौसलों से उड़ान होती है। सो जहाँ भी हैं, जैसा भी मिले, जो भी मिले, फर्क नहीं पड़ता। देखिए, एंड एक और बात मैं बोलूँगा, कि जब हमने एमडी एंट्रेंस एग्ज़ाम लिखा पीजीआई चंडीगढ़ में जाके, तो कॉमन एंट्रेंस टेस्ट नहीं होता था, हर सब्जेक्ट का अलग एंट्रेंस एग्ज़ाम होता था, ठीक है। और वो पूरे लंबा इम्तिहान होता था कि शॉर्ट केस, लॉन्ग केस, वाइवा, इंटरव्यू। तो मैंने 2 सब्जेक्ट भरे, एक जो मैं करना चाहता था और दूसरा जो मेरा सेकंड चॉइस था। सो माय फर्स्ट चॉइस वाज एमडी मेडिसिन, जो मैंने भरा, और दूसरा भरा एमडी रेडियोलॉजी। और क्योंकि नई नई टेक्नोलॉजीज आ रही थी, शायद मैं उससे इम्प्रेस होके मैंने रेडियोलॉजी भरा। और 2 सीटें थी मेडिसिन में, 2 थी इन रेडियोलॉजी। एंड तब कोई लिस्ट भी नहीं लगती थी। अगले दिन सारे हम बैठते थे कॉन्फ्रेंस हॉल में, ऊपर 4 प्रोफेसर बैठे हैं, और जो सिलेक्ट हुए हैं उनका नाम बुलाया जाता था। तो जब मेरा नाम बुलाया तो मैं ऊपर गया, तो मुझे उन्होंने कहा कि आप फर्स्ट है वेटिंग लिस्ट इन मेडिसिन, मतलब आई वाज थर्ड इन द लिस्ट, एंड यू आर फर्स्ट इन रेडियोलॉजी। और मुझे 3-4 सेकंड दिए उन्होंने चूज करने के लिए दोनों में। तो ये भगवान ही है जिसने सही चीज़ चूज करा दी। मैं आज भी कहता हूँ कि अगर मैंने एमडी मेडिसिन ली होती तो शायद मैं किसी डिस्पेंसरी में काम कर रहा होता। सो
दूसरी तरफ भी मिल जाता सर आपको।
व्हाट आई विल से इज कि जो भी आपको मिले, बिकॉज हो सकता है जिन्होंने ज्वाइन इन किया है सबको रेडियोलॉजी ना मिले, हो सकता है आपका दिल किसी और सब्जेक्ट के लिए हो, पर जो भी आपको मिलता है, अगर उसमें आप लगन से काम करेंगे तो कोई मंजिल आपको मिलेगी मिलेगी, उसमें कोई दिक्कत नहीं है, एंड यू विल लर्न टू लव इट। और आप ये देखेंगे, और हमने तो ये देखा है, जब 5, 10, 15 साल बाद, और मैं तो बड़ा डिसअपॉइंट हुआ था उस दिन, जब 15 साल बाद मैंने देखा, तो मैंने कहा ये भगवान ने सबसे सही चीज़ यही कराई कि मेरे को रेडियोलॉजी दे दी, कि रेडियोलॉजी मिल गई। सो हम अपने सोच से, अपने दोस्तों, फैमिली सलाह करके जो डिसाइड करते हैं, भगवान हमसे ऊपर है, उसको हमारी भले का और ज़्यादा पता है। सो मैं ये कहूँगा, जो उसने आपको अल्टीमेटली दिया, आप उसी में एक्सेल करिए, एंड यू विल डू वेरी वेल इन लाइफ।
No, thank you very much for your time, sir. And it's really an honor to spend this much time and guiding students. I mean,
It's an honor
I
for
know
me
that
as
we can
well,
talk
Majan.
on and on, but I know that you have a flight to catch. And thank you very much, sir. And maybe some of the students will sometime will reach out to you about
एंड जो दिल्ली या दिल्ली के आसपास रहते हैं, वो आइए हमारा सेंटर देखिए, देखिए रेडियोलॉजी कैसे होती है।
No, thank you very much, sir. I mean, it's a real honor for me that you have given such an insight about the radiology. See, I always wanted a exact perspective of the radiology from the person who is on ground, totally into the radiology, and that is why I requested for your time. But I'm sure it's such a pleasure for everybody to listen to you. Maybe I'm going to take some of their doubts related to the colleges that are
Thank you.
there.
And I've been very honest, I've been frank, I've been straightforward, and also remember, we straddle the entire ecosystem of radiology. We have standalone centers, जो कि हॉस्पिटलों के बाहर हैं. We run the departments within hospitals. both nuclear medicine and radiology. फोर्टिस में 2 डिपार्टमेंट हम चलाते हैं, गंगाराम में चलाते हैं, PSRI में चलाते हैं, and we also run departments in large government hospitals. We run the department of the Sports Injury Center of Safdarjung Hospital, which is through a public-private partnership. So what insight I'm giving straddles the entire ecosystem of the practice of radiology.
Yeah. I mean,
I'll take your leave, Rajat.
thank you very much, sir.
Very
Thank
much.
you very
This
much,
is a
sir.
great initiative,
Thank you.
and all the very best to each and every one of the youngsters who has tuned in. You are the best of the best, and may you do very, very well in life, and may God always be with you. Thank you very much.
Thank you, sir. Thank you. Thank you very much, sir. Thank you. All right, guys. So this is about Dr. Harsh Mahajan, sir. I mean, I have seen how the sir has taken the radiology to a different level. And I mean, from a radiology center to now integrated diagnostic with genomics and everyone. Now, I can take up some of your doubts related to the colleges and anything that you have. But if you look at it, the reason of inviting a person who is not linked to the teaching was just to give you the broad idea. And as sir has rightly mentioned, always remember that the amount of earning that you have is not dependent on the branch. It is totally dependent on your skills and your ABC, which is an availability, behavior, and competence. And the C instead of competence can also go with communication, how well you are able to communicate onto your thoughts. Okay, and it's not just the money, it's about the overall respect that you earn in the system. And moreover, what I have realized it over a period of time is that uh, it's the contentness that is much more important. And the moment you become at this stage, you think that it's the money that gives you the contentness. To some extent this is true, but not in the entire extent. It's the overall value addition that you're doing to the system, and that is it gonna be doing. Okay, now coming on to your straightforward standard questions, always remember that the first thing is narrow down onto the branch or the subject that you are planning to do. Like a lot of students were writing it that whether they should do radiology or whether they should do dermatology or orthopedics. Always try to think about it, that what are your primary concerns in the life as a doctor. I mean, do you want to be a page 3 personality? If you want to be a page 3 personality, then usually the standard point is that go to a branch with a direct patient interaction when you are a primary caregiver to the patient, like an orthopedics, like medicine, like surgery, like dermatology, or those. Or if it does not matter to you, if it does not matter to, as sir has said, see, if you're ready to work for a longer hour, then the sky is the limit for you in any branch. But if you're not ready on all those, then you want to do a 9 to 5 job, then radiology has a pretty decent scope, but then the earnings are limited. Obviously, there is always a cap, and as sir has mentioned, the good part about the radiology is, as Moore has mentioned, there's plenty of the government jobs that are available. Most of the seats in these cities like Delhi are going empty, going vacant. There are nobody who is ready to join these seats. I mean, in the government system. So, they're easily available in comparison to the branches like gynecology, pediatrics, when there is a very, very big competition for the government post. But see, these list of the all India and the counseling that I'm going to share in depth with all of you, don't bother about it. We are not having any counseling nearly in May or April or May or June. So, we have enough amount of time for that. So I'm going to share those in depth with all of you. Some of the people are creating the rumors that the NEET PG counseling is going to be before INI CT. So please remember, it is not going to happen. It cannot happen before the INI CT. So don't bother about it. So what is the order of preference of Chandigarh, Rohtak, Pune? Don't worry about it. I will be having the detailed sessions for all of you on all these points, that how you should do it. Right now, the biggest point about this particular session is insight about the radiology, whether is it matching to your priorities or not? Because a lot of people just think that कि radiology ले लो, अब तो life में बहुत पैसा आने वाला है, and that is how, है ना, वो I always do it onto this. So ऐसा नहीं होता ना. It's a different perspective. Yeah, there might be some changes in the counseling pattern this year. I mean, there are assumptions, and there are, I think I will be having a detailed session. I'm just doing some thought processes on this, and those sessions are going to be there for all of you. Okay. But the whole idea was that it's a great branch. Try to pick up a so-called the branded medical college. If you're getting it, there is no doubt about it. If you're not getting a branded medical college, then go for the colleges that have got a complete radiological investigations that are available. If you don't get them, then DNBs are also very, very good options nowadays. Then obviously comes the DMRD and the diploma programs of the National Board. If you have identified and if you think that you lack something, there are alternative resources that are available. Indian Radiological Imaging Association, ICRI, they do a lot of online structured training program. I'm also trying to do it. AI is not going to impact too much. They are having a scope of fellowship programs, but a general radiology still has got a lot of scope. Ultrasound still remains the charm. It is not being impacted by anything else, which is the major charm to the radiology. That is another important thing that is there. And do reach out to me if you think that I can be of any help to you. This is one of the series, one of the session that I did for the radiology. I am trying to bring more and more people from the practicing specialties. So I'm trying to bring more people from their own specialties linked with medicine, surgery, orthopedics, and them who are core into the core practice of that particular subject, who can give you an unfiltered advice about the branches. Because sometimes the way that you look at the branch at your end is not really the branch that it is. Okay. All right. So that is all, guys. Thank you very much for your time. I hope the session is of some worth to you. Do let us know if we can do anything for you. Okay. Take care, and all the best, and congratulations to all those